We ran this event in partnership with the Festival Ideas in order to open up some big discussions about the health and care system in our city, the current challenges we're all facing together and some of the choices we've got to make for the future. Above all, it was an attempt to really get the public involved in the discussion in a way which we maybe haven't managed to date. And I'm really pleased with both the range of contributions from a whole range of people, from the Mayor to local commissioners, to representatives of local carers, to people running big trusts up and down the country. Lots and lots of ideas about the issues that we face and how we can start to tackle them.
Well, the NHS is so critical to everybody in society, and I think it's really important we get a more nuanced debate that doesn't fall into the trap of either demonising the NHS or portraying it as if it's all run by angels. And it's really important. We own the NHS, the public own the NHS, so I'm delighted that people want to come and turn out and talk about it.
Well, it's very important that we have a healthy city and a healthy city for all. And we've got extreme health inequalities across this city. And I think that's a matter of us bringing together all our expertise right across the city. And this is both physical and mental health, to make sure that we are pooling our resources and thinking about prevention before cure. We operate as one city, and we should operate as one city. And I think it's really important that we break down the barriers between the various interests in the health community.
It's absolutely critical that Bristol is a place that discusses ideas, that knows what it thinks and knows why it thinks it, and actually has space for thinking about things differently. And we give space to that difference of worldview. And we know the evidence tells us that it's having a diversity of thought at the table that produces greater ideas.
Today is really important because it gives an opportunity for people to say what's bothering them and to actually be honest about their situations. But also it's important because big changes are started with tiny steps, really. So if somebody goes away from here and thinks differently about how to care for their mother, or I set up a meeting that enables a family to get care that they otherwise wouldn't have been able to access, those are small changes that could go on to start something really, really big and important.
Lots of challenges, but I think what's been great about this last few days is that some of those are now out in the open, maybe in a more explicit way, and in a way which the people of the city are more engaged in, hopefully, than they were a couple of days before. And my open invitation is for people to continue that engagement by getting in touch, helping to shape our agenda, because ultimately what's important is that the people of the city, as well as the professionals in the health system, are involved in discussing change and what that's going to look like.